A sequence of steps brings about hemostasis. So there is a sequence, and what is the sequence? Uh, there is vasospasm, followed by platelet aggregation. This is followed by activation of the coagulation pathway that results in coagulation. And this, in turn, is followed by thrombolysis. The first two is formally classified as primary hemostasis. Coagulation is secondary hemostasis. So normally, let's say blood is flowing in this blood vessel. So there is flow, and we have these platelets kind of going along the flow. And this is an endothelium that has not been breached. This is the normal endothelium. So in the normal endothelium, we don't want thrombosis to take place. We don't want clot formation. So this endothelium has got an anticoagulant phenotype. That's to say, in the normal course of life, it doesn't promote clotting if there is no need. So how does it do that? So if we look at this sequence, intuitively we would think that the endothelium prevents platelet aggregation and it should prevent coagulation, and thereby it could maintain this flow without clot being formed. So two things here. It would be preventing platelet aggregation and it would be preventing coagulation. How? Okay. So the anticoagulant action. So let's take it one by one. Okay. So platelet aggregation. So how does the endothelium prevent platelet aggregation? So one of the most important components that activates the platelets and make them stick together is something that we call ADP. Okay, so that's adenosine diphosphate. Okay, so adenosine diphosphate. So this component activates the platelets. Okay, as we'll see further in the lecture. So the endothelium produces enzymes. So let's write it here. The endothelium produces enzymes which degrade ADP. Okay, so if there is some bit of ADP that is formed, the endothelium produces enzymes which degrade it and prevent the platelets from sticking to each other. Okay? In addition, the endothelium produces prostacyclins and nitric oxide. And again, this has got antiplatelet action. Okay, so it prevents platelet aggregation. Okay. Coagulation. So the endothelium produces a component called thrombolytic, and it also produces certain chemical components like heparin sulfate and something similar to heparin sulfate, which is dermatan sulfate. So these components, they are basically anticoagulants. Okay. So they kind of enhance the activity of the circulating anticoagulants. Okay. So from both this we understand that endothelium in the normal case produces components that prevent platelet aggregation and components that act as anticoagulants, and because of producing these two in the normal course of events, the endothelium has got an anticoagulant phenotype.